Different.
Some forces stopping, trying to not prevent this meeting from happening, but it's gonna
I
happen.
know.
Mhm.
It really is. It's amazing.
Okay, so I'm Dr. Morgan. I'm a family nurse practitioner, and I am talking to Dr. Denise Jones today. She's a clinical psychologist, and we will be discussing childhood trauma from a psychologist's perspective. So, we had two discussions with Dr. Darby, and we addressed childhood trauma from a spiritual perspective. So today we're going to go a little bit deeper. Dr. Jones, I just want you to tell us a little bit about yourself. What do you do on a daily basis in your office as a psychologist?
Um, as a psychologist, I work with a lot of different people, ranging from 3 or 4 years old to 80 years old. A lot of people that I work with have a significant history of trauma, even really not realizing that they've had trauma, but and don't understand why they are acting or behaving in the way that they are. But the root of it is mostly due to trauma. I do therapy, I do psychological evaluations, provide diagnoses, transfer clients to psychiatrists. That's
That pretty
that's
much
my day.
sums it up. Okay.
Yes.
So childhood trauma has resulted in many dysfunctional relationships in children and adults. Most cases of physiological illnesses occurred as a result of triggers from psychological events from our past. How do you define childhood trauma?
Childhood trauma, I would say, is an emotional shock to the individual, so severe that they are not able to handle it, and it causes significant distress, and it makes it hard for them to process or understand what's going on.
Okay. So what are some of the chronic behavioral patterns that you see in children who suffer from childhood trauma? And I know that this is in different age groups because for like a smaller child, you might notice them start having enuresis or regress to previous stages of development. Uh, a school age child might behave a different way and teenager might behave differently. So what are some of the patterns that you see in children and then also go over into adults?
A lot of times it depends on the type of trauma. If it's physical trauma, the child, even at a young age, if they've been physically abused or witnessed domestic violence, those children tend to be more aggressive than the average child of that age. They may be withdrawn, whiny, hard to comfort, especially if the parent is the abuser and the parent is also trying to comfort them. That child is going to be difficult to manage, and they're going to be have some attachment issues. If they're school age and they've experienced some physical abuse or exposure to violence, um, you see a lot of classroom disruption. They're argumentative with the teacher. They are aggressive toward their peers. A lot of them have some emotional disruptions, especially toward the end of the day when it's time to go home. A lot of kids, they become very distressed, have anxiety because they know what they're expecting once they return home. They don't know if the parent is going to be okay or in a bad mood and take it out on them. So it causes a lot of distress for them. Teenagers, boys, aggression, drugs, drinking. For females, they may be hypersexual, just trying to find love, trying to get some comfort in any way that they can. And so if a boy is nice to them, okay, whatever it takes to keep you being nice or for you not to leave me. So you have those issues. Sexual trauma, that's a different thing. Like you said before, enuresis, that's a really common factor regarding um, sexual abuse or molestation. Uh, Even if babies, a long time ago, I worked for CPS, and there was this baby, like a year old, who was being sexually abused and just really cried all the time, just couldn't be comforted, wouldn't eat. It was just a lot. And so, even a child that young, something that traumatic, they have no voice at all. And so, the only thing they can do is cry and be irritable. And so, with that negative, with that type of temperament, it just adds on to other abuse. If the mother can't calm the child down, it often leads to physical abuse. So it just adds on to that. Children who are a little bit older, um, grade school, they they may be hypersexual. They may touch kids at school. They may talk about sex. They may expose themselves to their peers because I mean that's what's happening to them. So it's okay. And also they have trouble making it to the bathroom, and they're afraid and embarrassed to say. And so it causes a whole lot of behavior problems because if you're using the bathroom on yourself, your peers are going to make fun of you. And so, not just the sexual trauma that you're trying to deal with and process, now you have this other thing. You're embarrassed. You can't make friends. People don't want to be around you because you have these issues. Middle school, middle school, high school, yeah, a lot of hypersexuality. Boys, they may explore with both sides, with boys and girls, depending on who's abusing them. They may have sex with women because that's who's abusing them. A lot of boys, they become prostitutes, very promiscuous in that area because, well, if I'm gonna get abused, let it be my choice. And so with females, drugs, alcohol, running away from home, hypersexual, just going from person to person, having sex, even with men. And so even now it's really bad because having a sugar daddy is so popular and made to seem like the thing to do. So, well, my daddy's having sex with me, so I might as well go get this old man and get something from it.
So the next part of the question was the behaviors in the pattern in adults. I can see where everything could lead up to certain behaviors that we see in adults.
Mm-hmm. Right.
Yeah,
So in adults, it's like people have a hard time forming relationships.
exactly.
They if they're abused as a child, they oftentimes, if they haven't dealt with that, they often end up in abusive relationships as adults. They are, or yeah, they do a lot of things that they probably wouldn't do if they hadn't been molested or physically abused. The average person doesn't want to be hit, but it's been
Yeah.
normalized to them. So,
And
I
I see
mean,
where suicide could be a result of this chronic
yes,
situation. They don't know who to turn to, how to resolve this problem. And you said something very interesting about the kids. They're going back home to the abuser, and the only way for them to express themselves is just to cry, be irritable. Some of them might cut themselves, bang their heads
definitely.
on walls. And now that you've said this, everything came clear to me when I go to certain facilities and I see little kids. I'm like, what would they be doing in here? And they won't talk. They're completely shut off. And it takes a lot of work to get them to need to open to the psychologist.
Right. You're exactly right. I did a lot of work in a residential treatment facility, And there was this one girl, she's probably 11 or 12. I worked with her for like 6 months before she finally talked about the sexual trauma that she experienced. I knew it was there. We would get almost to that point, and she would revert back and change the subject. But yeah,
Wow.
a lot of self-harm, a lot of anger, rage, because they're too embarrassed to talk about it,
Yes.
but it's too much for them to keep in.
Okay. As parents, we do have expectations for our children and we want them to outperform us, our achievement. Um, just shifting a little bit on childhood trauma that might stem from parental pressure. Should parents accept their children's academic performances? You're spending money on these kids to go to college. So they better get it right and pass the course one time or else. Without
Exactly.
we do that
Even
without knowing that we are putting a lot of pressure on our kids, causing some amount of trauma. Should
yes, it
we acknowledge
does.
their ability, maybe look into other avenues that they might be good at instead of going to university?
Yes. I mean, I, myself, I take my daughter all the way to this special school downtown for high school. And girl, you should be doing way better than you're doing. I could sleep later. I could go to work earlier. There are a lot of things I could be doing. But we do have to recognize, why are they not performing the way that we want them to? Are they doing the best that they can? Or is something else going on? Or is this just not the right environment for them? And so I think it really just stems on a conversation. We talk to them, ask them questions, make them feel comfortable being honest. I I don't like school, and so I'm just doing just enough to get out. And so, okay, you don't like school. What do you want to do? And how can I help you get to the next level
Mhm.
so that you can be a productive citizen?
So I understand that, but what if the child doesn't really know what they want to do? For instance, my daughter, she told me she wants to travel the world. And I said, great, you're going to be a flight attendant. She said, no, I want to be the passenger on the plane. So um, that's not realistic, right? For her to be the passenger on the plane because somebody has to pay for that trip. So
Correct.
when a child reaches a certain age and they're not ready, they don't know what they want to do we put a time frame on them to say, okay, by XYZ time, I'm expecting you to know what you want to do. You should be making some serious decisions about your life. Because,
I think
suicide is very high in college students
college,
and
yes, it
high
is.
school students because at high school, they're now transitioning from teenager to adult, and they have to make the decision to go to college or get mommy or daddy mad. And they're in college, they're not performing the way they should. Mommy and daddy still gonna be mad. So sometimes they don't know any other way out more than just to end this.
Correct. I think certainly there should be a timeline, but if they're not ready to go to college, then okay, you don't have to go to college. You can take your first semester off, take the first year off, but you do have to work. You do have to do something. You have to be productive. You
Yeah.
can't just lay in your room, play video games, or watch TV or make TikTok videos all day.
So we have to help them to channel a healthy behavior that is sustaining and realistic as an adult now. You're no longer a child.
Exactly. I mean, that is our responsibility as their parent, is to help them be an adult. And if they're not ready, why aren't you ready? Maybe they need to go to therapy. Maybe they need to talk to a career counselor or somebody like that to help them figure out some things. Maybe they're depressed or just don't have the motivation that they need.
Yes.
And so a behavior therapist could help with that.
Okay. So, your role is very, very important, Dr. Jones, and it's a very
Mm.
underutilized service. People only come when they're forced to go. You need to go see a therapist, and once they get that right up, they go. But I think your
Yeah.
service could help a lot of us try to identify what our trauma is, identify the triggers and ways how to deal with the triggers to deal with these when they come.
Yes. But people have a negative outlook on therapy. You don't have to come to therapy just because you're having problems or because you're depressed or whatever. Sometimes you just need somebody to talk through a certain situation. You're stuck in a career, you're not happy about it. Your family's like, girl, you're making that money. You have to stay there. But you need someone outside to just bounce ideas off of, help you make some different decisions.
And you're
And,
not crazy
and
if you go to see a therapist.
exactly. But back to trauma, yes, a lot of us as adults are functioning through trauma. We haven't dealt with it. We try to pack it down, but that doesn't work. I do a lot of bariatric psychological evaluations, and one of the questions on there is, do you have a history of childhood physical or sexual abuse? And you can see the women, their whole body change, and a lot of them will start to tear up and say, I thought I was over that. I thought I was past that. I wonder if that's why I'm still having issues, intimacy issues with my husband. I
Right.
wonder if that's why I've been married 3 times or can't keep a relationship. So even though you try to push it to the back of your mind, it's still there. And if you really haven't dealt with it, it comes up.
You know
It
what just came to
does.
me, Dr. Jones? I'm gonna bring you back on and I'm gonna invite people to join the Zoom. Maybe this is not for Facebook Live. This
Mm-hmm.
is a very, very deep, very, very deep topic, very, very deep issue because it is so realistic in so many ways. And we experience trauma without knowing that we are going through trauma. And
That's
as
exactly
adults,
right.
we become functional traumatic people.
Yes.
We function. It's just like a drug addict who become a functional drug addict. I have known patients who function from Monday to Friday, and Friday evening they check themselves into ER, and they're in the hospital for the weekend, saying that they're in
Wow.
pain, getting narcotics around the clock, and then Sunday evening, I'm ready to go home, and they go back to their life, and they do that every weekend. So they're functional drug addicts. So
Wow.
we have people with trauma, we're functional people with trauma. And sometimes people behave a certain way. For me, I might encounter some patients and I might ask the patient a simple question and the patient just go off on me. And I'm sitting
Yes,
there like, what did I say to this patient? Why is this patient behaving like that? What I said to the patient is a trigger,
exactly.
and the patient
Exactly.
react to the trigger. And even some of the shootings, school shootings, stuff that is happening out there,
Yes.
people are responding and reacting to triggers. And that is why
Yes.
we have to be very careful what we say to people, how we say to people, de-escalate situation when it happens, because we don't know what trauma that person comes with.
Exactly. You're exactly right. I, my parents divorced. I was 11 or 12, and I knew it was sad, but who knows anything about trauma at that age, right? But I was like, oh, I never want to get married. I'm just going to be by myself the rest of my life because I don't want to go through the pain that I saw my mom go through. But as an adult, when I started dating and having a relationship, I was like, that was trauma.
Yes.
That was a very, very traumatic experience for me, but I didn't realize it. I had an eating disorder after that. It was like I had everything, I held it all in instead
Yes.
of expressing it and talking about it. And so that's what hurts us. We don't talk about it.
Mhm.
We're embarrassed, we're ashamed, or oh, that makes us look dumb or whatever.
And we
But
don't want to be
something
vulnerable.
That's a big thing. I was vulnerable at that moment and I got hurt, so I'm not going to do that again. What's the point, right? So yeah, it's trauma comes in a lot of different forms, and sometimes we don't even think about it. People experience trauma at work. You get
Yes.
constantly getting passed over for promotions, constantly getting passed over for promotions, getting the messy, sorry jobs that no one else wants. So that's trauma.
Yes. Talking about, going to therapy, I've always heard people say therapists do not solve your problem. They sit down and listen and let you solve the problem yourself. What role does a therapist play in the session?
We play a role, different types of therapy, but mainly we I'm more humanistic and cognitive behavioral. So I believe that we all have what we need in us to heal ourselves. And so yes, we're going to work together as a team, talk about what's going on, figure out why, and
Do
as a
you give
team,
suggestions? Do you give
oh,
suggestions?
absolutely, give a lot
Okay.
of suggestions, homework, because some things the person would never think of, but I'm listening to you. I have training. Did this happen to you? How did you feel when this happened? And then it's like, oh my gosh, you're able to put two and two together. It makes sense now.
Okay.
And
Okay.
so it's a lot of corroborating effort and working together, a lot of empathy, listening, understanding, and really just building that person up to do what a lot of times they know they already need to do, have, but just don't feel like they have the strength of it.
So what if the person is getting the therapy, have a certain behavior, and they are, say for instance, a couple, the bad one, and you need to nip it in the bud and let the person acknowledge that they have certain behaviors that need to be addressed. But if you say that, you might hurt the person feeling, it might not come across as therapeutic. Do you still tell the person, or how do you get that out?
You say it from a place of empathy. So I've noticed you've been acting in this certain way. Tell me why you think you act like that. When you do these things, do you get a positive reaction or a negative reaction? How do you think it makes the other person feel? How does it make you feel when you act like that? Oh, it makes me feel powerful. Why would doing this particular behavior make you feel powerful? Oh, well, that's what my dad did to my mom. So it all goes back. So
Yes,
you
sir.
can address any issue, and as long as you're doing it with empathy, it works out. I haven't had any issues.
Okay, great. So you are in Texas, and what if people who are watching need to speak to you in particular? You have a very calm voice, soothing. You look like somebody who I could really talk to. Or other people in other states out of Texas can be treated by you?
Yes. Since COVID, teletherapy has opened it up, and the state of Texas allows us to work with a lot with people from other states.
Okay, great.
Mhm.
Where can you patients find you?
Healing Hearts,
Uh-huh.
MHS.com. I'm pretty sure that's it.
Is there a phone number for your office?
Yes, 713-859-9647.
Okay. Thank you so much. And we're going to bring you back on. And
Thank
whatever is
you.
happening out there on Facebook, you're going to be on Facebook. Okay. I don't care what's blocking it. Your voice needs to be heard on that
Thank
platform.
you.
Okay. I'm gonna
Thank you very
save
much.
this recording and I'm gonna put it out there because there's so much more that needs to be discussed. And I thought I was at the end of childhood trauma, but you have raised some points where, trust me, we need to go deeper. And if you are available, Dr. Jones, I am more than happy to have you back on to discuss different aspects of this child trauma.
I'm always here to help. I love this.
Okay, thank you
Thank
so
you.
much for coming.
Thank
I
you, Dr.
appreciate
Morgan.
you. And you did excellent, excellent. Great.
Thank you.
Okay,
You
I'm
were
gonna
asking me
end.
those questions.
Yes, and you did well in answering those questions. Okay.
All
All right.
righty
Have a
then.
great day. Bye-bye.
You do the same. Bye.